There's a lot happening with New Jersey's child welfare system. We want to help you make sense of it and share our story. This is DCF on the Air.
This is DCF on the Air, and I'm Jason Bukowski. When we talk about the Department of Children and Families, there's an interesting thing that happens. We are the one department where our goal is to make sure that people aren't involved with our department. We try and figure out ways in which we can support families by kind of circumventing some of the traditional routes that we've done. So if a family has a need, sometimes they would call the child welfare line in order to access the services that we might provide. What we're finding more and more is we're trying to provide that access to services without deeper end involvement with the child welfare system. In order to do that, we have a partner, NJ211, that provides a referral to a number of state services. It's not just DCF services, but there are a whole host of services available from the state as well as community partners. So today we're inviting 211 into our studio to talk a little bit about their work, and I'll turn it over to them to introduce themselves.
Thank you, Jason. I'm Melissa Akery. I am the Chief Executive Officer of NJ211.
Thank you, Jason. My name is Louis. I'm part of the Database Resource Services at NJ211.
Great.
And I'm Samantha. I'm one of the contact center supervisors.
So Melissa, Louis, Samantha, thank you so much for joining us on DCF on the Air. So I'm going to start off asking a little bit about the 211 service. I'm wondering if you can give us a little bit of history. When was it actually launched in New Jersey? And then talk a little bit just generally about what are some of the services that are offered to New Jersey residents through 211.
So a little bit about the history of 211 really starts with the 211 dialing code becoming a national code that the FCC approved in 2000 so that people in need of health and human services had a starting point for information and then referrals to programs. In New Jersey, it was the United Ways of New Jersey that brought the service in 2002, and then in 2005, it was statewide, so all 21 counties have this service. So what is it? It is a place to call when you're not really sure where to start for help, or you have a situation and you know that you need to connect to assistance in your community. It also is a place to search for help. We have a website and we manage a very large, comprehensive resource directory of, as you mentioned, government programs, community-based programs, faith-based programs that provide either free or low-cost services. So the service is 24/7, whether you're trying to call us. We are always open every day of the year. You can text us at 898-211. You can chat with us on our website, and you can also go to our website to search our directory.
Great. And what's that web address?
The web address is very easy, nj211.org.
Great. So I know that there's a couple things I wanted to touch on in your response. First is, and Samantha, Louis, if you guys have anything to add here, feel free to jump in on this too. But I'm wondering what happens when a family calls and they know they need help, but they don't know what that help looks like. They don't know the name of the program. They just know that, hey, my heat's going to be turned off. How do I get my heat to continue? How does 211 provide that support that's a little bit above and beyond just referring to a service, that you're actually helping the family kind of solution and walk through what that help might look like?
Well, I'll start by saying that information referral really is an art and a skill. Mm-hmm. It is a combination of, first and foremost, listening to the person, making them feel comfortable speaking to you. It takes a lot to make a call for help. Yeah. So our team is personal and professional. They welcome the person, put them at ease, glad you called us. And then we listen to their situation, and then we ask some questions. And the reason we ask questions is because not everyone is in the same situation. You could have someone who's working, someone who's not working, a family, a single individual, a senior, a veteran. So by asking some questions about them and their situation, we then can put things together to say, okay, based on what you've told me, here's some options for you. Sometimes it's just information, and sometimes it's a combination of information and then programs. And our staff are very well trained not to overwhelm someone and to try not to underwhelm them, right? To give them just the starting point that they need.
Yeah, great. I know that 211 is a nonprofit agency. It's not government, but it works very closely with government. And as I mentioned in the lead up, it's not just a DCF partnership. You've been partnered with us for, I think, probably since as soon as it went statewide, because we weren't a department until 2006. So probably very shortly thereafter, you've been a partner with DCF. But I'm wondering what that partnership looks like for other state agencies. How many state agencies are represented by the service?
We have very strong partners in the Department of Human Services. They were the reason that we could go 24/7 when we first launched.
Yep.
Also, the Department of Community Affairs, the Department of Health, and also the New Jersey Office of Emergency Management for our role that we play during disaster.
Sure. Yeah. And I think that's really important. I think it's really focusing on those people-centric services, right? The services that we can offer social supports to. But I'm wondering, are there other areas where we could look to 211 to maybe expand that a little bit? Are there other services that maybe aren't currently offered that you'd like to see incorporated?
I definitely think that we are well positioned to do additional programs that align with our mission. I'd like to see us do a little bit more with some care coordination in the area of housing. I think we can work closer even with the Department of Labor for people who are unemployed, that they're aware of the services that we can provide, not only with job training opportunities and preparing for interviews, but also all the social service programs that we have while they may be going through some financial hardship. So I do think in the Department of Health, we know that health today is not just your medical health, it's your social health, having healthy foods, having a roof over your head, things of that nature.
Yeah, it's things that we talk about when we talk about the social determinants of health. What are those things that contribute to an overall sense of well-being? So I think that's important to note there. Are there other agencies in the state of New Jersey that provide a similar service to 211, or do you kind of have the market cornered?
Well, there's a lot of specialized information and referrals. So we work closely with the Division of Disability Services in DHS. They are devoted to providing expertise in programs for individuals with disabilities. So we know that we can give some information, but we're definitely going to refer them to that source. The same with, there's many of the child care resource and referral centers. Every county has one. We know we can count on them to focus in on some of the child care programs. So there are other specialty areas, but I believe that we're unique in that we are so comprehensive. If people need help, they'll call us for one thing. and Samantha probably could comment a little more, as we begin to speak to them, what they're telling us is only the tip of the iceberg. You know, we need help. We're going to be shut off. Our electric's going to be shut off. And as we start to talk to them, we find out they're unemployed. They're unemployed because they have no child care. And before you know it, we're able to address the underlying issue. So I think that we're unique in that we are statewide and we are the most comprehensive and I believe the largest resource directory of human services.
Yeah, and I think that's an important point to make, though. We were talking before the camera started rolling about how asking for help is such a difficult thing, and I think a lot of times when your family gets to the point where you need to reach out for help, you've already experienced some adversity. You've had this, you've kind of just dealt with it. You've had this, you've kind of just dealt with it. You've had this, you've kind of just dealt with it. And now you've reached this point where you can't deal with it anymore. So you're reaching out for that one thing, not realizing that there's a whole network of services and supports that are out there for you and your family and the unique circumstances that you have that can provide some assistance in a number of areas where you didn't know help was available. So I think that's an important, being able to navigate that and to kind of connect the dots for people and have that, what I refer to as like a 50,000 foot view, because you are familiar with the services. You're not necessarily in that moment of need and panic. So it's not like I'm only focused on the stress. I'm not focused on the solution to that stress. You have the solution, so you're able to make those connections for people. So I think that's an important aspect of the service. When we think about 211, and you referred to it as information and referral, and I'm wondering what's the difference between what you would kind of consider as a typical information and referral program versus something that's a little more like case management?
There definitely is a difference. Let me just say that the work that we are currently doing with the Department of Children and Families came about because the number one need that shows up on all of the county human service assessments that they do within their community is always, I don't know where to go for help. I don't know, I don't know what's available to me. And that conversation was at a multi-state department meeting where our Department of Human Service partner shared with Katie Stower from Department of Children and Families, you need to check with 211. They're already doing a lot of what you're going to be looking to structure, right?
Yeah.
So really, the need is to have a starting point. Where do I even start? So referral is someone calling, listening, and being able to direct them to a service or a program. And we sometimes say that's an open referral, right? Valuable. Navigation we do as well. Samantha does this on the Home Energy Assistance Program. So that encompasses more. We're going to explain to them what they need to do to maybe obtain that service. So we're going to screen you for your income eligibility. We're going to explain to you how to apply, where the application is, what you have to bring with you document-wise or submit, what you can expect with the time frame of processing, how you will be notified. All of those things help the person to understand the navigation till they either are approved or denied the benefit. So that's navigation. Now, case management is much more complex. It's usually like what a social worker will do, and it may incorporate referral, navigation, but what What else it will involve is really working directly with that individual or family on tracking the progress they're making with the services. So that's a little bit deeper. Each one of those have a value. And at 211, we definitely are doing referrals, and in some cases, we're also doing navigation.
Yeah. And I think that's the differentiation, is that when you're looking at case management, you typically find out what the resolution of that concern was, because you're working closely with the family, and you get to the point of resolution. In this case, we're opening the door for them. And I think that, again, going back to the conversation that we were having a little before the camera started rolling, that gives them the power to kind of control the uncontrollable. They've been living with this stress, kind of like holding them down, and now they have a path forward that they can follow. That, giving them that path forward, giving them that ability to kind of pursue that, lets them get a little bit of their power back. It lets them, they're solving their own problems.
Right. The
Yeah.
end of the call is typically very different than the beginning of a call.
Yeah.
And it is about getting empowered. It's about hope, not only in the resources, but somebody cared, somebody listened, and somebody was knowledgeable. That makes a huge difference.
Yeah. Samantha, let's talk about the beginning of that call, though.
Yeah.
Because I don't think that they start from a place of hope. I think they're coming to you from a place of panic, right?
Absolutely.
Yeah.
When our consumers call in, they are very vulnerable at that point. They're confused, they're stressed, they're overwhelmed with financial needs that they're facing, personal problems that they have going on at home. And when we get on the line, we want to, introduce ourselves, but we want them to hear our voice and to let them know that we are here for them, a lot of reassurance to help them and letting them know we're here for you. We're going to hopefully get what you need so you can get where you have to get.
Yeah. And I can imagine that from a staffing perspective, that can be really stressful too, right? Because you're hearing people's stories. I mean, I imagine you got into this work because you want to help people. And I imagine, if you talk to most people, that's why they're doing what they're doing, either through 211 or DCF. But that initial contact, you're dealing with people at their point of most vulnerability, where they may be experiencing the most stress that they're experiencing throughout the course of this journey. And people aren't always nice in those sort of positions. How do you handle that? How do you kind of like move forward and kind of get them to a place of calming down maybe a little bit, hearing what you're having to say, but also giving them the compassion and empathy that they need in that moment to kind of hear that things are going to be okay?
Yeah, I think a lot of it has to do with reassuring them that things are going to be okay. We try to let them hear us and hear how our tone is, making them feel more at ease. Once we start asking them the questions, well, what is it that you need? What you're looking for? Usually when they go to certain places, they don't get asked so many details. So when we start asking them things that just make sense, they're like, okay, they really are listening to me. They really are they're trying to meet the need that I have. Getting personal, letting them know that things are going to be okay. A lot of that.
Yeah, great. So I want to ask a little bit about what role lived experience might have for the staff at 211, because I know that, even from the department, we've talked a lot about how we can engage people with lived experience to help design or co-design the future of child welfare. But when you think about the number of people at DCF, I want to say our DCF workforce is maybe 50% people with lived experience. And it makes sense, because if you've been in that place and you've experienced this adversity, you may be more dedicated to wanting to help people. But I'm wondering, from the perspective of 211, how does lived experience play a part when you're relating to a family that might be saying, oh, well, no one's listening to me anyway. And I haven't been able to get the help that I need. And they're really kind of starting to spiral. How can you use that lived experience to kind of assure them?
We definitely could do it on a daily basis with our staff. A lot of our staff have, or are living in those conditions, or, have been through things, me personally. So, being a mom, it's, when you have those consumers on the line who are single mothers and are struggling with childcare and not being able to go to work because of the fact that they can't afford the childcare. So letting them know, hey, I understand, I'm a mom as well. It's hard. But once they hear that, someone else is going through what they're going through, they also, they feel, they know how we feel at that point.
Yeah. Yeah, and I think, because I've experienced it myself, my day job, believe it or not, podcasting does not pay the bills. But, my primary role within the Department of Children and Families is as the Director of Communications. But at DCF, unlike some of the other state agencies, we have a really broad view of what communications looks like. So our communications, it could be legislative affairs, it could be constituent relations. So we do all of it, not me personally most of the time, but I have had conversations with constituents. And again, they're getting to you at that point where it's like, I'm exhausted, I'm stressed, I've looked at everything I can look at online, I've tried to solve this thing for myself, and I don't know where to go. And being able to say, I'm a dad. I know what that looks like. I know when your kid is sick and you trying to get them health care or get them to the right doctor or there's some other need in the family and I need to get this need met. I've experienced that myself. So being able to say, you're okay, you're gonna be okay, and I know this because I was there. I think that's got power to it.
Absolutely.
Yeah. Let's talk a little bit about we talked a little bit about the history, we talked a little bit about what 211 does. Let's talk a little bit about the evolution of 211, because I think in the last, I would say maybe year, we've worked with the 211 team to kind of move us more into the 21st century in terms of how do we support families with the website redesign, getting the word out about 211, helping with the public awareness of the program. So let's talk a little bit about what are some of those steps that have been taken recently to maybe upgrade the platform, modernize the platform, to make it more accessible to more people within the state of New Jersey.
Well, I think first, just the recognition of what we were doing and that it's valuable, and then for DCF to say, we want to help you get to the next level because it's going to help our constituents and our initiatives, what we're so committed to. You mentioned earlier that a lot of calls come into the abuse line that truly are not abuse. And they're not neglect, they're poverty, and they're about people not knowing that there is resources for that. And the professionals who sometimes will make that report doing what they think is the right thing, but just not knowing that 211 should be the first call. So realizing that, DCF took a look at starting with our website, because that is the public portal that anyone can use at any time. It's multilingual, and we recognized that we really needed to upgrade it. We wanted to make the user experience as simple and results-oriented as possible. So we spent a year with a variety of stakeholders from different state departments, county departments, nonprofits, and those who use it, youth, families. There was a fathers group we spoke to get everyone's input on what is the best approach and the needs of the website. And we ended up a year later launching, it was February of 2024, our new website that is simpler, it's cleaner. The layout lends itself to almost a calmness and a easy focus on being able to get the information and get the help. So some of the advancements include a more intuitive search. So if you type in a keyword of clothes or food, a list below it will start to populate with terms that will take you to those resources, being a little more specific, like food pantries, or food might be baby food, and also agencies that provide that food. And so that makes it a little easier to get closer to the right resource. We also had geolocation, so that wherever you're searching from, you would be able to find the things closest first. So we're in Trenton, we look for food, the closest resources are going to appear. We also made sure it was mobile responsive, so that the website, whether you're looking on a phone, a tablet, or a laptop, is going to be the same and easy to use.
Yeah.
And I think one of the most important things was thinking about accessibility. So with a click of a button, you can change the entire website and directory to the language of your choice, and there's 200 languages. In addition, we selected colors and layout that are more accessible for visually impaired individuals. So those are just a few highlights of, the reorganization and the advancement in the technology, so that the end user has a more successful experience when they come to our website.
Yeah, and I can tell you, looking at the site now, it is so much cleaner. I can definitely get that sense of like tranquility and peace, and it's an extension of the whole philosophy that it'll be okay. It's
Right.
gonna be okay. Type in what your question is. We've got the answer. It's gonna be okay. Like that kind of thing. Now, we talked a little bit about people connecting to the service, asking for help. But I think the other crucial thing with 211 is that it's an aggregator for services. It's an aggregator for programs, whether at the state level, whether community level, nonprofits. I'm wondering, and Louis, I think this one is for you. How does an agency get their services listed on 211? What's that process look like? How do they reach out and make sure that when that question for help comes in, that they have their services listed in the solutions?
Well, there's many ways that it happens. I meet them in person when I go to outreach, or when I talk to them on the phone. We could conduct a phone interview. There's a form that I send out that they could fill it out, and they'll send it back to me. We get it. I review it, and then input the information to the website and into our system. And also, besides the phone call, the interview, the link that we also send out, and the link makes it easier, because that I use a lot when I'm in person, because I take my laptop with me, and as I'm meeting this agency, I explain to them how to search, how to look, and once I explain the benefit, they like it. They immediately tell me, yeah, I want to be a part of 211.
Yeah.
Because one of the things that I always emphasize that you close at 4:30. We 24 hours, 7 days a week, and consumers are constantly looking on our website. And for specific need, your agency come up, they'll go to you.
Yeah.
Or we have a call center that answers these calls, and depending on the need, your agency come up, we send them to you. So once they see the benefit on the spot, sometime on the spot, we put them in the system.
Yeah. Now, once an agency is listed in the system, outside of just getting that greater awareness and connection to constituents and consumers, what other benefits are available to the agency that's listed there? What else can they do on the site? I know that there's a database or there's new and improved metrics and reporting that comes along with the new site.
Yeah. I just want to also say that Louis and the team that curate the data are phenomenal, because it is a huge undertaking, over 6,000 resources, and we have a living, breathing directory that we're proud of. Anyone can build it. It's the maintaining of it.
Yeah.
But what agencies can learn about their services is that our dashboard, which is 2 years old, it's public on our website. It describes the number of contacts we're getting, the needs, the clients themselves by the different demographics, their ages and languages. We also indicate the services that we've referred them to. Now, it's not based on an individual, it's aggregated. So you can see that what were the top 20 referrals? What agencies did we send people to? And you can look at that not only by the state and the individual county, but you can get as granular as the municipality or the city to say exactly in Bloomfield, how many, what were the resources for the people that were in Bloomfield. And you'll see those nonprofits, you'll see those government programs listed. So they have an idea how often we're sending people, whether they call them or not, we're not sure. It might also tell an agency that isn't there, hey, you know what, make sure 211, maybe I need to heighten my resource and find out why it's not being, referred.
Yeah.
So that kind of information is available to the agencies. And one important feature of the new website is that we made it as easy as possible for all programs, agencies, government entities to update their listing without even talking to us if they don't want to. They can, like Louis said, he shares a link with a user ID. They can then just go in, okay, we're changing our hours for the food pantry. Okay, we're closing that site for the next 6 months. They make those changes, easy peasy, comes through to our data team, they review it, and as long as they have no questions in 24 hours or less, it's updated. So we've added that feature last year that we did not have, and we've gotten a lot of positive response from the agencies about it.
Yeah, I can imagine that could be super helpful. I think whenever I'm thinking about, like, how do we have a collection of resources that we can provide to families, as soon as you publish that, it's automatically obsolete because things change so quickly. But the ability to go into the system, to update that information, and then 24 hours it's live on the site, I think is really fantastic.
Yeah.
So 6,000 services?
6,300 programs represents about 2,100 entities, agencies, because most agencies will provide more than one program.
Yeah. So Louis, what's your favorite one? You
don't have to answer.
I assume the answer is DCF programs, of course. But I'm wondering too, like with that analytical tool, you can actually look. So if I'm a service provider in a particular city or wherever, I can look and say, okay, these are the asks for help in this municipality. So that could represent an unmet need. And maybe I know, okay, well, I'm providing this service now, but maybe we need to launch a program that helps with after-school support because that's something that keeps coming up in the metrics or something like that, where I think, if you're an enterprising nonprofit, you can adapt your service array to meet the needs of the community through the information that you're getting through this analytical tool.
I'm glad you brought that up because so many of the nonprofits, including ourselves, are looking to apply for grants or to expand services. They can use our data as a source of support in their documentation of their grant as to why they would like to add after-school programs. And to see that, over the last 2 years in our community, there have been X number of requests for that need to 211. And so it can be used for data to support their own their own needs.
Great. So I know that, because we're talking about an information and referral service, so often the contact with the family ends when the phone hangs up, right? We don't really know what happens after that. We hope that the family then reaches out to the agency, gets the help that they need, that we've, connected them to or navigated them to. But we don't always get that closure. We don't always get that sense of, this happened and this family got everything that they needed and whatever problem they had was solved. I know 211 is a confidential service, just like anything that we do through DCF, but I'm wondering, for Louis and Samantha, have you had opportunities to actually hear from people that have benefited from 211? Have you heard those success stories? What does that look like?
Yeah, we've had many success stories on the phone. One that I can remember is we work with the Department of Health with the Health Equity Program. Mm-hmm. We had a consumer who called in looking for food resources. We provided him with what we could as far as food pantries, soup kitchens in his area. And with the Health Equity Program, we have the opportunity to schedule a follow-up. So we followed up with the gentleman a month later just to see how the resources went with what his initial need was. When we followed up with him, it turns out that he was explaining to us that he had to cancel a health screening, a very important health screening that he had to get to due to lack of transportation. So with the Health Equity Program, we were able to get him connected with a Ride United code that we would offer them to get him transportation to get to this health screening. So we were able to schedule that for him. He was able to reschedule his health screening. He got to it successfully. And then we followed up again just to see how everything went with that. And he said everything went smooth and he was able to get everything that he needed from the beginning with the food until the end with his health screening. He was able to go, and we hope everything went well with that too.
Yeah. So that's a great example, though. You've reached out for one thing, and then there's other things that are available, other services that are available. So you went from, I need access to my local food bank, to now I've gotten transportation to an appointment I wouldn't have otherwise made. So now you're addressing some other need. I think that's fantastic. Congratulations.
Thank you.
Yeah, another experience, this happened, last year on October 4th, I believe. I was at an outreach in Camden, and I usually greet people. I'm very friendly. I treat people like if I know them.
Yep.
So as I'm greeting this person, I was like, welcome to 211. Do you know what we do? How can we help you? And she was like, I know you guys very well. And she said, last year I was in a domestic situation. I was suicidal due to everything that was happening. And somebody, by word of mouth, gave me 211 number. And when I called them, you guys were so professional, and you're so empathetic, and you helped me, and you guys referred me to a halfway house where they took care of me there, and on top of that, you guys follow up. You also helped me with counseling. So we provided all of that for her. And she said, and then a year later, I get to meet this person. She's telling me, this happened last year. I'm here today because of 211. I'm alive because of you guys. You guys do an excellent work. And she got all emotional, and I'm over here kind of like, oh my goodness. Yeah, because I wasn't expecting. I'm like, you definitely know 211? She's like, yep. And people that was around, around the area, they started clapping because she was loud enough. Yeah. So people were able to witness that. And they kind of like hug up on her because, yeah, she got emotional. But it was a great experience because I'm like, wow, what we do is meaningful. It's not just a 9 to 5. Well, I'm sure we 24 hours, but it's the type of job that you make a difference in people's life.
Yeah, you don't punch in and punch out. This is meaningful work. When we talk about the work of the department, and I think this is probably similar to 211, it's not a vocation. It's not a gig. It's a calling. You're called to help. You're called to help these people, and I think hearing those stories, even though you probably don't get them often enough, that probably carries you through, right? When you have that caller who's like, you guys are no help. And of course you're helping him, or you're trying to help him, or I'm saying him because it's probably usually a guy. But even though you're trying to provide that help, and they're just in a place where they can't hear you because all they're hearing is the stress. Having those stories where you know this service works, you know it works because you've heard from people that have directly benefited from it. That's got to be, the best morale booster you can imagine.
And it's probably at least 3 times a week, if not daily, that Samantha and the other supervisors call out a kudos to someone who the person who called us, we refer to them as consumers, that the consumer expressed the value of the call, whether it was just, I was feeling so low and now I'm feeling hopeful. The person was so patient, explained it over and over. But that email that all staff see reminds them, of course the person who did it is being recognized, but it reminds everyone of the power of what we do, that never to underestimate the power of a 6-minute call, a 10-minute call with someone who's in need. It makes a huge difference.
Yeah. So we know that through these stories, we're really establishing how impactful, how powerful the 211 service is. But unless you get that family calling in, you can't provide the help. And if they don't know, well, first off, it's right there. Call 211. 211 is in the name. So those stories, I think, are fantastic in terms of, explaining how meaningful the service is to the staff that are performing the service. But that's not something that you put on a billboard. And unless you have the families calling in to ask for the help, we can't provide it. We're not proactively reaching out to every family saying, hey, what's your need? So we're looking for them to contact us. They need to know that the 211 service is out there. So in the last year, I know that we've really pushed for more public awareness, and DCF has worked with the 211 team. I know Dana has been really great in that regard, so I do want to shout her out there. But I'm wondering, can you talk a little bit about what's being done to get the word out about 211?
Absolutely. And thank you again to DCF for launching an ad campaign to raise awareness. And yes, Dana Catapano, our Director of Community Outreach, has worked extremely closely with DCF to make sure that the message is clear. And we have seen results of that. So since March of 2024, and it will go all the way through to June of this year, a campaign was launched with social media. It was launched with different banners or materials on buses, trains, bus stations, in pharmacies. So there was hard material developed, there was social media, and the goal of the campaign was to spread awareness. Be aware that what 211 is, how you can connect with them, how you can search their website. And it has been successful. We have seen an increase in our website searches. Over last year, we saw a 6% increase, which more and more people are coming to our website, and even more are actually using the search. And I believe that really was our goal. The other goal was making sure professionals like teachers and police officers and healthcare workers knew that 211 could be a resource for their clients and patients.
Yeah.
We ask a question. How did you know about 211? And what we are seeing as a result of the campaign is more healthcare professionals are using the service. And we also saw that a lot of people are referred to it from social media. They're saying, we saw it here, and they're contacting us. They're calling in.
Yeah.
So I think that the goal has been reached. We know that what we would like to see happen is that 211 becomes a household number, just like 911, where it's recognizable. I may not need it today, but I remember seeing it on that bus terminal. I remember seeing it in social media. When I do need it, or when my neighbor needs it, when my relative needs it, I just have to say, go to 211, go to their website or call them. That's really what it's about, and I believe we're achieving that goal.
Yeah. Something you'd said about the connection to more law enforcement, teachers, healthcare providers reminded me of the presentation you gave to the task force conference earlier this year, where we specifically invited some of those folks that are typically the ones calling the child abuse hotline because they're aware of some family that has some unmet need. And that confusion, and you mentioned it a little earlier, of, you know, this child's coming to school unfed and they need support. So I'm going to call this in because I don't know who can provide the help. But now this family has deeper involvement with the child welfare system. That carries a stigma, that carries trauma. They may not always be willing to accept help from the child welfare system as a result of that.
Yes.
Or fear that maybe we're going to talk about taking their children from them. That's not something that we do in New Jersey, but still trying to get people on board with, you know, our vision of what child welfare can and should be, that we're providing assistance and support. So I'm thinking about, you know, what's the role that 211 can play that is not necessarily the child welfare system, but still provides those material supports that people, in fact, we have parents that call the child abuse hotline, and it's heartbreaking that they're calling because they can't support the kids in the way that they feel they need to. You know, we are going to lose our house. We can't put food on the table. I'm calling myself into the child abuse hotline because I can't do it. And what can you do for us? How can 211 play a role in that sort of evolution of, or transformation, because that's the big word that, you know, the whole DCF on the Air podcast, it really talks about, the transformation of child welfare into something else, something better, you know, a family serving system, not a child welfare system.
Right. A helping system.
A helping system,
You know,
exactly.
not a accusation system or, you know, looking to penalize someone. And I think it's with what we have already described as being a place where we meet you where you're at with no judgment. We have compassion because we understand. Many of us have experienced it, and we want to help you. We know that most services will start at a local level. It'll start right in their own communities and in their counties. And so we are that, again, that calm, reassuring, and skillful service that points them in the right direction and, again, gives them the encouragement to seek help. You know, a lot of times people will say, but I called 211 and they didn't help me. Well, we don't have the direct service, but we're going to connect you to that direct service. It really then takes your next steps to pursue it. And there'll be some cases where we might know somebody is extra vulnerable and needs more advocacy. We can advocate on their behalf.
Sure.
So I just think that if more people knew that there was this service as the starting point, they would utilize it, and the results, most of the results would be that they would never need to contact the abuse hotline.
Yeah. And when I think about the benefit to agencies, you know, if I'm thinking about like a local community support agency, maybe they don't have a lot of resources, or any of the resources that they do have are going into how do I support this family, not how do I get the word out.
Right.
So 211 gives them that opportunity or that platform to get connected to the families that they need help.
That's a good point. They don't have the time to be answering the phones and answering the phones. So if we answer the phone, we assess and we look, because we know programs have eligibility. There may only be one program that they're eligible for, but at least with that program record being updated, we have that information and can send them to that organization. So we've almost done a little bit of the vetting to some level, that they can focus on direct service and we can focus on just assessing the situation and giving them the right information and the right programs that they seem to be qualified for. We always say that, organizations may run out of funding, they may change some things, but what we can see, you look like you would be eligible for this. So
Yes.
following up is important.
So it's almost like a light touch screening for that agency.
Yes.
Yeah.
Yeah.
So thinking ahead a little bit, we definitely value the partnership from DCF. Hopefully you value the partnership too. But I'm wondering, what does the future hold for 211, and specifically the partnership with the Department of Children and Families? And are there things that we could be doing to better support 211?
Well, hopefully it will continue to grow in the work we're doing. I would like to see more work on follow-ups so that we have more ability to actually not just answer the call, but have a team being able to call back. We do send out text survey follow-ups. That needs to be revamped to be a little bit more specific, so we're really understanding the people who say, I got help. Did they help themselves? Did they get the help through the agency? The people who didn't get help, why? Because I think if we can gather data on that, we can then share it with the agencies, we can share it with our state partners, because then we can improve things. So I'd like to see us be able to close those referrals with our team as well as technology to a higher level and utilize that data for improvements.
Yeah, I think that would be, and again, it gives us those stories, so that at the end of the day, like Lewis and Samantha shared, you've got that closure that at the end of the day, I helped, I made a difference, and you go on to help the next family.
And it adds value to the agencies, it adds value to the consumers who, that we are able to make that kind of improvement for them by sharing information.
Yeah, that's key. There's power in information.
Yes,
So.
I came across a saying that said, information is the antidote to fear, right? The more information, especially with our role during disaster, when times are very turbulent, whether it's weather-related, whether it's a man-made disaster, when people have information, they can be a little calmer. We saw that even with COVID, right? So another saying for you.
There you go. I like that one. Information is the antidote to fear. So I'm gonna keep that one in my notebook. So I just want to say thank you so much for all of the services that you provide to the state of New Jersey, to the families that we care about at DCF, to get to that solution that they need, to find that solution to a problem that they're experiencing, to de-escalate the stress, and to let them be the nurturing, successful, wonderful family that they can be. So thank you to the 211 team so much for all you do to make that possible.
You're welcome, and thank you so much for having us and for your faithful support of our mission.
Great. So next month, we talk about transformation here at the Department of Children and Families. We talked today with the 211 team about how we're transforming, again, from that idea of child welfare into something else, something better, helpful, to a family-serving system. Next month, we're going to be talking, again, on the topic of transformation, but a little more on that transformation from childhood to adulthood, specifically for children, youth with intellectual and developmental disabilities. We have a system here in New Jersey that supports the children and youth under the age of 21 through DCF. And then after they age out of that system, they may go on to the system supported by the Department of Human Services for adult services. So we're going to talk to some of our folks from the Children's System of Care to talk about how we can support families as they make that leap from childhood into adulthood and continue to get those services seamlessly. So whether we're talking about transformation of our system or we're talking about that transition from childhood to adulthood, that more individual focus, you can hear all about it through DCF on the Air. So on behalf of the Office of Communications and Public Affairs at DCF, on behalf of my producers, thank you for joining us, and tune in next month for more DCF on the Air.